All right, this is Dr. Hether with the Chirotouch Macro. I want to make a little video for everybody out there to help them document and be safe with this coronavirus going on. So here's a little macro I wanted to share with everybody who wants to watch this on YouTube. If you go under your individual notes where you have your daily notes and whatever date you have, I always start off with pushing the button that says Corona screening and bullet, everything is okay. It's on the fourth row, two down, and it looks like this. You push one button, it has today's date, and it says that he denies having any fever, cough, shortness of breath, not traveled overseas, not been on any cruise ships, or been around somebody exposed to the virus or diagnosed with it. So that's a real simple button to touch. And if you need to touch it, if someone was exposed, you can change it from there. But to actually set this up, what that looks like is if we go under our photos, you just go under the all-in-one provider and hit the toolbar on the far right. The next thing you would do is go under chart notes and then go under setup. From setup for your main menu page, somewhere on the top, I just typed COVID-19 screening bullet, that everything was okay. And then I made the header, COVID-19 screening. This note was taken on this date so that we all know when it was taken. The patient's first name, and then I say he or she, and then the next set looks like this. The first screening denies. This means everything's okay. It's bulleted this way, but the next sets of questions are if they weren't. So the next one says they don't have a fever, but if they do, you can change it to has a fever, has a cough, has been out of the country, all that. And then the same thing is no treatment, reschedule after 14-day isolation. Patient needs to contact their primary care physician. But that's how you would set up the macro any way that you want so that it's in there. Bullet the negatives, but you can take away those positive checks and turn it into positive findings. On our door in our office, we have a little thing outside the door so that everybody walking into the office does this. I encourage everybody to do this before anybody walks into the office, and also when new patients call in for your office to ask them these same screening questions. All right, if you have any questions, please feel free to send me an email or give my office a call. Elsewise, we'll get through this together. All right, thank you so much.